Listen to us live on www.z.
Good afternoon to our officials, members of the press, listeners, and viewers. Today's press conference has been called to allow officials to update the press and, by extension, members of the public on latest developments on COVID-19. As you're all aware, the COVID-19 situation is a rapidly evolving one, and as such, the government of Montserrat will continue to implement new changes to correspond with the developing situation. The press conference will be conducted virtually, as will future press conferences, in line with recommendations to limit contact with each other. The press conference will take the following format. Premier Honorable Joseph E. Farrell will deliver remarks. Following this, members of the press will be allowed to ask questions on the COVID-19 situation. On the line on Skype, we have Narissa Golden of Discover Montserrat, Bennett Roach, editor of the Montserrat Reporter, Vernia Bass of 664 Connects, and Malika Mackenzie of Aliogana Express newspaper online, and they'll be connecting through Skype. James White Jr. of Radio Montserrat is here, and he will be asking questions to the press during that time. We also have the Minister of Health, Honorable Charles T. Kernan, and Director of Primary Health Care, Dr. Dorothea Hazel Blake, on hand to answer questions from the press also. Now, I'll take you over to Premier Honorable...
My fellow Montserratian residents and members of the press, good afternoon. As promised, I will continue to update you on my government's actions as we work through this COVID-19 pandemic together. As part of the Ministry of Health's response to managing the COVID virus pandemic here in Ireland, samples are collected from persons displaying flu-like symptoms and are sent overseas to be analyzed. On Monday, March 23rd, 2020, the ministry sent 8 samples to the Caribbean Public Health Agency CARFA laboratory in Trinidad. The results of those samples returned on Tuesday, March 24th, 2020, showing 7 negatives and 1 positive case of coronavirus. Last evening, through a Government Information Unit press release, the result of those tests were shared with the population. Therefore, the Minister of Health, Honorable Charles Kernan, Director of Primary Health Care, Dr. Dorothea Hazel Blake, and I are here to provide a further update and to respond to questions from the press. As of yesterday, Tuesday, March 24th, we recorded a 2nd case of the coronavirus. And while we were hoping for no additional positive cases, we have to accept this reality and implement measures to prevent any further transmission. 1 additional case of COVID-19 is 1 case too many for Montserrat. The announcement of Montserrat's first case would have caused some anxiety, and no doubt the announcement of a 2nd case will cause further concern, and quite rightly so. After all, we are dealing with many uncertainties where this virus is concerned. In my past press briefings, I reminded you, the people of this country, that your health and safety is my government's top priority, and that if and when circumstance demands, my government will not hesitate to put additional measures in place to safeguard your health. Following last night's announcement, Cabinet convened an emergency meeting and has agreed on some additional measures. The measures in place will provide for total shutdown of Montserrat, with exception of the private of essential services. These measures are being put in place for the suppression and containment of COVID-19. The new order lays out what we term essential services. The order also provides for lowering of the gathering of persons from 25 to 4. As of tomorrow at 6 p.m., no gatherings larger than 4 will be permitted on Montserrat, with one exception. Funerals, the numbers are 15, 5 for funerals. However, this number 4 does not apply to airports, customs, and seaport for passengers embarking and disembarking on the island. And it does not provide for persons providing essential services in Montserrat. We continue to ask you to adhere to social distancing. That is 6 feet between each other to avoid the spread. In addition, a curfew has been implemented from 7 p.m. daily to 5 a.m. daily. From 7 p.m. daily to 5 a.m. daily. During the period 5 a.m. to 7 p.m. daily, persons are permitted to be in public places for certain purposes. That is, for medical purposes, pharmaceuticals, for shopping, for traveling to and from work. The purpose of engaging individuals in public is not provided for. We also provide for persons to gather in no more than 4 for the purpose of exercising, as we recognize that the health of our people does in fact require people to exercise. So no more than 4 persons can be together for the purpose of exercising. The order also provide for these business places to close at 6 p.m. daily. These essential services that provide service to people close at 6 p.m. daily to provide for workers to be off the street before the curfew hour of 7 o'clock. The restriction of this curfew does not apply to essential services, such as Montserrat Utility Services, the hospital, the police, and fire service. The list of essential services will be detailed in a further broadcast. In addition to these measures, the previous measures which were in place is still continuing. Schools are closed. Persons entering the country will be in quarantine for 14 days, mandatory 14 days isolation. And may I add here that this order comes into force at 6 p.m. tomorrow, Thursday, March 27. Sorry, 26. 26. Tomorrow, March 26 at 6 p.m. However, while we continue to do all in our powers to keep you safe and healthy, we also need everyone to play their part to prevent, detect, manage, and contain the spread of COVID-19 within our community. the government of Montserrat does not take the health of our population lightly. As we see the widespread effect of this pandemic is having on the lives of peoples across the world. To this end, the police will be given additional responsibility within the confines of the law to arrest and charge persons who have been found to be violating these measures, as it is only by complying with these regulations will we be able to manage this crisis effectively. Thank you, and may God bless us all.
Thank you very much, Premier Honorable Joseph E. Farrell. We'll now open for questions from members of the press. And as I would have indicated earlier, the questions from the press are being asked virtually. So just as a matter of structure, let me point out that what we'll do is start with ZJB. James White Jr. will ask the first two questions, and then we'll continue to the other media houses in that order, and we'll continue in that vein throughout the question and answer period. So I'm just waiting for an indication that we can
That's fine, that's
proceed with
fine.
the first question from Mr. James White Jr. As you know, as I would have indicated, we're doing this virtually, and so with the use of technology, we have to, at some times, we have to ensure that everything is coming through clearly and the officials are able to hear clearly what is being asked. So I am giving an indication now that we can proceed with the questions from the members of the press. James White Jr., please proceed with your first two questions.
Thank you very much, Fiona. And also let me take this opportunity to thank the Honorable Premier for availing himself today and to give us an update. First of all, Mr. Premier, and possibly that we can have the Honorable Minister of Health to speak to us along these lines too, and also maybe Dr. Hazel Blake. Now, the Honorable Premier mentioned about essential workers, those essential workers who will be on the front line, so to speak. What provisions are made for the protection of these essential workers? And also you can add what provisions via compensation or allowances, hazard allowances, that these essential workers will be afforded.
Thank you, Mr. White. Very good question. Management of these various utilities in essential services will put in place those measures as they see it fit to protect their workers. And compensation for these workers will also be worked out within the various institutions as they continue to put in place measures for their protection and safety.
Okay, just by way of following on that particular question. In terms of the protective gear, PPE, for these essential workers, and specifically I'm looking at the nurses, for instance, because they are the ones who will be facing patients. So I'll have Dr. Hazel Blake, if you can come in here and speak to the protection for nurses and workers.
In terms of whether we have access to protective gear? Is that the question?
The question is, will they be afforded these protective gear, and if we have sufficient to deal with that? For the past couple of weeks, all of our staff who are on the front line, or even those who are not necessarily on the front line, who have been required to deal, whether it's with patients at the St. Peter's Health Center or those at the hospital, have been provided with the recommended gear. They have N95 masks, they have face shields, they have isolation gowns, they have
means of washing their hands. We make sure we always have we have running water. We have liquid soap. We have the means to keep your hands washed. So yes, they have already been provided with all the necessary equipment, and we will continue to do so as long as supplies last. The problem is we're not sure how long this whole matter is going to last. So like the rest of the world, we are using our supplies as well as we can without wastage, because we do not know, even if we had the money, where we would find additional supplies at this time should we run out. But as we speak, we have adequate supplies that would certainly take us over, well, a couple of weeks well.
Okay, thank you. Those were the first two questions from James White Jr. We are now moving on to questions from the Montserrat reporter. Bennett Roach is on Skype, and we are going to connect with Mr. Roach now. So we're connecting with Mr. Roach of the Montserrat Reporter newspaper via Skype to get his questions. Are you hearing us? Mr. Roach, are you able to hear us? Move on to Discover Montserrat, Narissa Golden. Can you hear us?
Okay, I suppose I'm with you now.
Okay, all right. So we just got Mr. Roach. Mr. Roach, you can proceed with
Yes,
your first two questions,
yes,
please.
yes. Thank you very much for affording me this opportunity from this distance. I have a follow-up regarding the essential services. James asked about the workers, essential workers, but the essential services. And you said you were going to send a list out. When is that? How soon is that list going to be available? Because that for me is critical to maintain. You're calling it social distancing, but if you guys had followed with UE on what they call this, it's really physical distancing is what you're talking about. Um, so how is that going to work for the essential services? You're going to have the supermarkets open, but there should be no more than 4 people gathering. How is that? What's the difference here? How do you separate the two, or distinguish the two? If you're going to have people in the supermarkets, how people will, can more than 4 people be in there? And how is that going to work?
The order provides for 4 persons to be at any one spot at a given time. That is the order. And for information in terms of essential services, the order will be made available as soon as it's signed. The order is out, and any media house or whoever will have access to that document. It's available, and we can peruse it and satisfy yourself with what's in it. But as it stands, as of tomorrow Thursday at 6 p.m., gatherings will be 4. It is up to the institutions to work out the logistics of having it done.
I'm sorry, I don't know how to explain this. I don't know how the public will take this and how they will practice that. I'm specifically referring to people who even going to the hospital or going to but mostly supermarkets, because people will at some stage wish to go to the supermarket. There's the question of going to the petrol stations and so on. That's easy because people stay in their car and buy their petrol and so on and go on. But I'm really concerned about people going out to do shopping. See, essential services could be could involve a lot of stuff, and I'm waiting to see what that list is, to see how people will conduct themselves.
Mr. Roach, is there a follow-up question?
Except that, I mean, the answer that the Premier gave didn't really answer what I'm saying. I'm concerned about people gathering at the supermarket or a shop, any shop, How does the four people gathering come into play there? I don't know.
Okay, the Premier has indicated his response to that question already. So if there is no other question coming from the Montserrat reporter at this time, we'll have to move on
Not
to
at
the
this
next
point.
media
Let's
house.
go on. Let's go on. Let's go on. Go ahead.
Discover Montserrat and Arista Golden, please proceed with your two questions. Thank you.
Good day, everyone. Could you tell us how many cases are you planning for in terms of preparation with your quarantine supplies that you have? About what's the expectation in terms of future plans for the disease? What's our numbers?
How many cases we're planning for? We were planning to have 0 cases. That's the short answer. But you mentioned quarantine. Let us make the distinction between quarantine and isolation. Many of the people who may be asked to be quarantined will be quarantined in their homes. There is home quarantine, and then there is quarantine in government accommodation if that becomes necessary. Then that's for people who have been identified as being exposed but have no signs and symptoms. Now, in terms of persons who we may have to isolate and treat, those are people now who clearly have signs and symptoms associated with COVID-19. We are in the process, of completing some renovations to the physiotherapy building on the hospital compound, where that is the space designated for isolation and for treatment. We also have one additional room in the back, at the back of the ward, that can be used if it becomes necessary. That's Plan B. Then the physio room, just in case you ask, I think comfortably in terms of making sure that the beds are not cramped or anything like that, it can accommodate 5 or 6 patients if that is necessary.
Thank you. As it relates to the vulnerable and those who are self-isolating and also under curfew, what plans are there for those that may need to do shopping in terms of the government providing any support? Also in relation to Meals on Wheels, are they going to be allowed to still provide meal to the people that they're already working with?
Sometime this week, I will be revealing a paper. Some actions that we are taking in terms of providing for the vulnerable persons. There are numerous ideas floating around, and as I speak, the team who's working on some mobile shopping, shopping for persons, preparing meals, expanding Meals and Wheels program, expanding lunch program. These are all the physical paper that have been presented. We'll be having meetings this afternoon to fine-tune that paper. So yes, we are working on every single individual in this country who may become vulnerable in terms of COVID-19. We recognize the fallout could be significant and that a number of persons will experience hardship, especially the seniors and the vulnerable persons in our communities, and we are making every effort to make sure that they are comfortable in riding through this storm.
Okay, thank you,
Thank
Larissa
you.
Golden, Discover Montserrat. We'll now have to move on to Aliogana Express for their first two questions. Aliogana Express, Malika McKenzie, are you with us?
Good afternoon.
See you with your first
I'm
question.
going to follow up on a question. We talk about essential workers, and I know specifically we were talking about the nurses and doctors. I would like to also bring to mind our firefighters, our police, and all of them. Are there any measures in place to prevent them from contracting and spreading the virus to other persons that they may come into contact with, even members of their household, when they finish their tour of duty?
Could you repeat the question, please?
I was saying, I know that Mrs. Dorothy Hazel said about the nurses and that they have gears for them. But what about our firefighters and like the police? Because police are there to put persons for quarantine, the measures for persons with quarantine and so in place. Do we have any way that we're dealing with those persons and knowing that they're going to go home to the members of the household when they finish their tour of duties, are there any measures in place for essential workers like those to prevent them from contracting and spreading the virus to others?
Yes, the answer is yes. As in the lead up to where we are now, in addition to the training that we conducted with health staff, we also conducted training and sensitization with members of the police services, fire and rescue, port authority, most of those that we consider to be frontline and those who we knew that we were going to have to be working with. We have shared some of the PPE we have certainly with Port Authority. I personally have delivered packages to Port Authority, to the police, and to fire and rescue. We may have some differences of opinion as to what is needed, because some people are demanding certain types of protective equipment. And from a public health standpoint, my position is this particular virus is spread by droplets. So primarily you need to have that type of personal protective equipment that protects you from droplets. And in addition to the knowledge, that will help you. And so that is the approach we have taken. And so we have certainly worked with most of our stakeholders. As we speak, even today, a member of our team should be meeting with another group of stakeholders as we speak, again, to sensitize and provide reminders.
Thank you. If persons breach their self-quarantine, is there a specific vehicle or persons who are assigned to pick up these persons? And where do we keep them in custody as to prevent the spread of the viruses, if not confirmed that they have the virus?
If there's a specific vehicle, I know we have had
Or is there, yeah.
been arrangements, and some of this perhaps needs to be fine-tuned, but we've had arrangements, again, with one of our stakeholder groups that wasn't necessarily about breach of quarantine, but persons who needed to be taken into a different location, for example, for quarantine, or need to be taken to a place of isolation. We will use one of the two vehicles at our disposal specifically for that.
Okay, can I just follow up with that? How are we sure that the persons in self-quarantine are remaining in...
Connects and then come back with your other questions, please?
Okay, thank you.
Thank you. Okay. So, Vernie Abbas of 664 Connects, please proceed with your questions.
Good morning, everyone, and thank you very much for having me. My question is directed to the Premier. To date, the government has spent a lot of time telling us about the things that we cannot do, but we've not heard much about what the government is doing outside of healthcare. The cancellation of St. Patrick's and the pandemic has placed a lot of stress on Montserrat's private sector. Is the government considering payroll support for hotels, restaurants and bars, etc.?
Thank you very much. As I said just a while ago, we have presently a package of incentive that we are discussing. We recognize that businesses will suffer hardship. We recognize that individuals who are out of work will also need assistance. And we are in fact putting together, or have in fact put together a package of assistance which will be fine-tuning. It will be revealed shortly, but you understand that financing is going to be an issue. We will use whatever resources we have until we get further assistance. But until then, yes, we are working to assist businesses and individuals.
Okay, as a follow-up question, sorry. Hello?
Yes, please proceed with your second question.
Okay, as a follow-up to the first one, will the utility service MOL reduce the cost of electricity and water by, say, 30% for the months of March, April and May? Is that included in your package as well?
I cannot speak for utility services. Most of them are statutory bodies. We are having discussions with them, and I believe that every institution in Montserrat is concerned that we survive as a people, and that they will do their best to help to alleviate the sufferings of us all.
Okay. Thank you, Premier, for that response. And I'll now again ask for the final follow-up questions from each media house. Thank you. Starting again with James White Jr.
Okay, thank you very much, Fiona. And Mr. Premier, I'm looking at support from the UK government to augment our resources that we have on island. I remember saying at a previous press conference that the FCO, and in particular the minister with responsibility for Montserrat and the other overseas territories, Baroness Elizabeth Sugg, they were finalizing assistance to the overseas territories. I'm not hearing what role that the British government is playing in terms of support to us in this situation.
We are aware of the procedures that are involved in terms of getting assistance from the UK. We have made representation, we have had assurances, but you also understand that the cases are made, but the UK have their own problems. And just yesterday we had a discussion with DFID. We have just received the MOU for our budget. And clearly they're going to ask us to revisit our budget and use some of those figures, those monies for what is going through. That's exactly how we operate in this time. So yes, the British assures us that they will support us, and we're in constant communication dialogue with them, and we have the assurance that they will come through. In the meantime, as a government, as a responsible government, we have to utilize resources that are available to us at this point in time to make sure that people are comfortable. We cannot sit back and wait until we receive a handout. We must use what we have. So we are garnishing all what we have to ensure that we have a package to deliver to help our people.
Yes, okay, this other question is for Dr. Hazel Blake. And there's been concern, or concerns, plural, as to whether or not case 1 had any contact with case 2. And added to that, have you been able to identify any additional quarantine spaces?
Let me deal with the second part of the question first. Quarantine spaces. The Ministry of Health and Social Services, there's a team dealing with that. And I'm advised that the team has several locations that if we need to, we will be able to put persons into quarantine. In terms of the patient, are you calling patient 1 and patient 2, meaning persons who tested positive? In investigating a positive case or somebody who tests positive for a particular disease, you do what's called contact tracing, where you sit with the person, which is what has been happening, members of our team, and so that you're not bombarding them with several persons. Any case we find is assigned with one caseworker. Now, it's not like we have lots of us. The caseworkers is only one of 3 people. And so that person will sit with their particular caseworker, and you encourage them to give a list of persons with whom they would have been in close contact. Now you're relying on people's recall, their ability to remember in the past X number of days, how many people did I have close contact with, bearing in mind that this is a condition spread by droplet. So based on the list that's provided by patient 1, as you call that person, it does not appear that the 2 had direct contact. And patient 2, as you will probably recognize, is a recent confirmation. And so that process started with that individual, and based on the analysis of both lists, it does not appear so.
Okay. The Montserrat reporter, Bennett Roach, your final question.
Listen, as a follow-up to what that last response, So we had people come in from this. Everything started, so to speak, from this BA flight into Antigua, and the first person being spotted as being positive. And people came to Montserrat, and since that we had a case. That all those people who came to Montserrat, many may have left, I understand, but how do these two cases correlate to the arrival of people from Antigua to Montserrat? And what's that we are going towards this length of shutting down, so to speak, lockdown as they call it. Have we done all of the tracing, and these two people who proved positive, did they have contact with that? And so that is Montserrat in danger, that there are people out there who may be having symptoms and so on, but who have not yet reported to you people? About the 7 people who you just reported, I learned that those people were there since the first one of the people, of the persons who were suspected. What's the story on all of that?
I'm sorry, I'm not sure I can answer all of that. Let me tell you. The first thing first. The first statement you made was that all of this started with the patient who arrived on a BA flight. First things first, that is not correct.
Not true.
That is when everybody on the ground got all excited.
Yeah.
From an epidemiological standpoint and from the port health standpoint, members of our team were out before that date. When we recognized that COVID-19 was spreading, and it was not yet even a region, but we acknowledged that for any disease to spread, it has to be brought here by some means. So we already initiated what we call screening, and just for clarity, screening doesn't mean standing at the port and taking people's temperature. Screening can start with simple questions. So the team sat down and devised about 3 or 4 questions which were given to the Immigration and Border Security staff to commence that screening, that type of screening. So this screening started before. It is through that mechanism and through the alert that came from our colleagues in Antigua that you had to shift gears now when on this flight of BA 2157, I think it was on the
13th.
The 10th.
10th of March, yeah.
And having identified that there was somebody who tested positive on flight, then we stepped up. So that's the first thing. I think you asked how they correlate with arrivals on Montserrat. Again, we did ask the persons who had arrived on the flight to call in and were being questioned and being spoken to. And the majority of people did. Persons called at various times. Some people called and were very irate. Some people called and were very helpful. As we are aware, some people have already left the island, and some people may very well still be here, which is where it takes me now to the third phase. Having opened up St. Peter's Health Center as a quote-unquote flu clinic, we continue to encourage people to come there, call there, and even through that mechanism, we have identified people who have either been on the flight or people who would say, I wasn't on the flight, but I had family staying with me who were on that flight. We had people call who were on 2157, but just not on that particular day, because you'd appreciate the same flight numbers repeated day after day after day. And so, while it's not foolproof, it is a mechanism that we have, and I think it has worked, because coming out of that, we were able to identify, as we said, in the first instance, 3 people who were tested, and 1 person tested positive from that first group. Then we sent 8 samples that you heard about, again, identified either through the contact tracing or people voluntarily coming forward because they were symptomatic and saying, I have signs and symptoms, and we sat and we linked them either to the actual flight or to persons who had been on the flight. And so that is how we link them, if that is the answer. And I think that's what I remember.
And may I just add to console the reporter, the question about spread. This is exactly the reason why we are locking down the country for this period of time, to ensure that if there are persons out there who are still positive, they will be restricted, and as symptoms develop, then the health authority will be able to deal with those cases, preventing the spread. That's exactly why we're taking this measure.
Okay, thank you for that.
Very well.
And also Dr. Hazel Blake. Now let's move on to Discover Montserrat. Your follow-up question, please.
Thank you. First of all, the limited number of questions we're able to ask is really a challenge, as there are lots of issues to be dealt with as the decisions are affecting quite a number of sectors. So it'd be good if we could find a way that we could get those questions answered, whether through the Director of Information, whether we can send you questions so we get further clarity. But there are issues around education, other things around healthcare that would be good to know, travel included. So my next question would be, Dr. Hazel, earlier you didn't quite answer my question as to how many people you're actually preparing for. I know you physically have a space for 5 or 6, but what are we expecting in terms of how many people can we handle? And seeing now that we have 2 cases, what's the expectation of how far this has actually spread in our community?
Okay, the reality is that we do not know. COVID-19 is a new virus. It is a new virus that, as we progress, the world is learning more and more about. However, if you look at other coronaviruses, such as SARS and MERS, which were around some years ago, what you call the attack rate is, in any outbreak, they calculate what's called the attack rate. What proportion of your population do you anticipate will be affected? And under normal circumstances, with things like regular influenza, we estimate a 25% attack rate. Please, when you report what I said. For influenza, 25% attack rate. We do not know if COVID-19 is going to conform to that particular reality, but we certainly said, all right, if 25% of our population gets affected, bearing in mind 80% of that number will have mild symptoms. I'm happy to report the most I can tell you about the 2 individuals that we have confirmed as being infected with COVID-19. Both of them appear to be having mild symptoms. So they're well with, it's a good place to be. They did not need to be hospitalized. They did not need to have any special type of therapy other than the usual care and support. And both are doing well as of now. The reality is when that can change, because as more people become infected and more people may become more ill, then we will deal with that reality. So it's hard, reporter, to say what that number is going to be, but my estimation, certainly when I was calculating for making sure we had PPE, was to work with, if there's 25% attack rate, let's work with 35%, so you have above and beyond what you actually need. And can we handle?
Thank you.
We're handling as so far, and with all hands on deck, and by the grace of God, we will handle anything else that comes our way.
Could you tell me what, in terms of their disparities in the numbers that we've heard about ventilators on island, can you tell us what that number is, and what other equipment are we expecting to get now or have received or in the near future to deal with this issue?
I am not, as far as I'm aware, we have 3 ventilators at the Glendon Hospital. I'm not aware if there was a disparity, but that is what I am aware of. That's the figure I have. In terms of additional equipment, we have, through our colleagues at Public Health England, made some requests, as have done the other overseas territories. We've requested additional equipment. I don't have the list with me, but certainly ventilators on that list we added ventilators. We've asked for additional personal protective equipment. We have asked for assistance when being able to test for ourselves. That would be ideal if we could get that, and we are awaiting their response.
through the Crown agent, they have the list that we sent, submitted with all the ventilators and the genetics machine for the testing. They have gone through that list and they have prioritized, it seems, the PPEs, which they have on order. We have asked since about the ventilators again and the test machines. So we are waiting for that follow-up. But we did in fact ask for it because we recognize that if things escalate, we would need those ventilators. So we have asked, and we are waiting and hoping that that will come true. I think Crown Agent already have ordered the PPEs. We are waiting confirmation that they have ordered the ventilators. The other thing I have learned as well, that for the ventilators, in ordering from another source, that these are not there on stock anymore, and so they are being made. So it seems to me there is a queue for these things globally, and that is the reality of this situation we are in at the moment.
Thank you.
Thank you, Discover Montserrat. We'll now go to Aliogana Express. Malika McKenzie.
Thank you. To follow up, when persons are quarantined, how are we sure that they are following the order, and what measures are put in place to ensure that they do?
Okay, sorry. Before responding to that question by Aliogana Express, the Premier was in the middle of responding to a previous question by Discover Montserrat, but we were not able to hear on our end. So, Premier?
Trying to just support the argument put forward by my colleague minister and Mrs. Blake, that we have made a list, yes, but we must recognize the demand that is out there for these equipment, because the world is reeling over COVID-19. Every country, almost every country in the world, is looking for supplies, and there's more demand than the turnout. So yes, we have a list for these things. We are waiting for word, and I'm sure when they become available, we will have them.
Thank you. Proceed, Aliogana Express.
Okay, my question is a follow-up. When persons are quarantined, or self-quarantined, I should say, how are we sure that they are following the order, and what measures are put in place to ensure that they do?
To be honest, we've been hearing reports of persons not adhering to the guidelines of the quarantine, and I am aware that that matter is being addressed. What will happen, what has started to happen, is that we are collaborating with the police, and they will be enforcing the law, because in truth and in fact, there is a Quarantine Act, and there is now whatever this instrument is that these lovely gentlemen have just
COVID order.
signed into law. So if the Quarantine Act says, among other things, that the chief medical officer can ask you to remain in quarantine, and if you break that quarantine, there are consequences. And beginning, we were trying to work with people and encourage you nicely and gently to adhere to what the law required. When you get to the point now when you begin to realize that some people are just being defiant and not adhering to the law, and in doing so, not putting themselves at risk, but putting other people at risk, my understanding from the authorities is that this is going to be dealt with in accordance with what the law allows.
Thank you. Thank you.
Okay, 664 connects. Your final question, please.
Okay, how many persons have to be infected for us to close our borders? And if we restrict entry and exit from our borders, how will we manage things like Medivacs and also deal with the fact that there's limited agricultural production on island?
Okay, that's a very good question. And you bring me into a very important part, which I left out in terms of when I was speaking to the restrictions, because what I actually have, and we'll share with the press, we actually have two orders. SRO number 19, which falls under the Immigration and Prohibition of Montserrat Act. I didn't speak to that one, and I need to speak to it now. In this particular order, it's the prohibition order, and it does in fact prohibit entry into Montserrat by persons who are not Montserratians. So as of tomorrow afternoon at 6 o'clock, A person traveling by air or sea into Montserrat is prohibited from entering Montserrat. Providing you are not a monstration, a person who holds a permit of permanent residence, a member of crew or aircraft, or husband and wife or child of a dependent person in Montserrat. So this is a separate regulation that governs entry into Montserrat. And the order also provides for, as essential services, Medivac is considered an essential service. So we must make provision for that. Getting food into the country is also an essential act. So we will make provisions for the ferry to make runs to collect food to bring in if there's a shortage. So in the order, provisions and considerations are made for exactly those things that you highlighted. So don't be worried. We have in fact taken this into consideration and you're taken care of.
Thank you very much to members of the press. I now ask for final remarks from the officials.
You want me to start?
Yes.
I would just like to, first of all, I want to thank members of the public who have been responding to our calls. I want to thank those who have, for instance, been attending the clinic at St. Peter's, because that means that they have freed up the other areas of our healthcare system to do the other tasks that we have to carry out. So thank you to the public. Thank you for responding in the way you have. Thank you for calling first, because by doing that, in most cases, we can give appointments. And now I'm hearing that we're not allowing more than 4 persons. I am yet to go to St. Peter's Clinic and see more than 2 people waiting at any given time. So thank you for cooperating with us. And let us remember that if you are informed, make sure you're being informed from reliable sources. And I want to take this opportunity, since I'm on this mic, to thank members of my team. I call them Team Awesome. The team, particularly, and I'm sorry, other people will have to speak for their team, but the primary healthcare team, those nurses and doctor, for instance, who are at St. Peter's Clinic Monday to Friday, appropriately dressed in their personal protective equipment, not murmuring, not complaining, not being paranoid, but just doing what healthcare workers do best. I want to big them up. So Dr. Skerritt, continue the good work. Nurse Iffy and Nurse Albert, thank you, thank you, thank you. And I'm sure Minister will speak about the rest of his team. I also want to thank the team that's doing the promoting, so persons like Nurse, like Penny Maloney, who's been working at additional times. And I want to say special thanks to Nurse Alex Aki, Nurse Violet Brown, and those, along with myself, are the contact tracing trio who are on the front line getting the abuse when you try to call some people, but smiling and continuing anyway. And so, team, thank you, and thank you to the public.
Well, I want to continue in that line, and while I will not call names lest I get in problems doing that, I want to also commend the team of which Dorothy is the leader, and the environmental team, the administration staff, the CMO and her teams, and the entire health ministry, all those who have chipped in any way. We want to thank them because they have been doing a sterling work from even before we had a case in the region. And they have to be commended. I know that there are a lot of expectations around, but we have to deal with what we have and try the best we can. And so I want to encourage every person on Montserrat to adhere to the rules, adhere to all the things that we have asked you to do, the cleansing of your hands and the hygiene, just the natural hygiene and all the things that will help you not to pick up this virus. As it has been said, it's new and people are still learning. If you pay attention to the airways, you realize that even the bigger countries are still learning about it. So we are still learning, but all of us can safeguard ourselves, and whatever we do, we must ensure when these measures come into place, make sure that the curfew is kept. I do not really want to say anybody have to be arrested, but if you break the curfew and break the quarantine, what has to be done will be done. And that is all I would say to you now. So for all of us as Montserrat who live here, do what we have to do to contain this virus. God bless you all.
I want to endorse the sentiments expressed by my two colleagues. In truth and in fact, we are sailing through uncharted waters. None of us, as a matter of very few people in the world, understand COVID-19. And so sometimes we may make blunders as we go along, but we are sailing along and we are trying to sail it and make things and make life easier for everybody. Before I close, let me also say, because the question is being asked about the public service. And I want to remind public servants that just this morning, an order, circular number 5, has been circulated. It deals with the closure of non-essential government services as of tomorrow. That order is there, and I'm sure the press, when Montserrat and GIU will take it and run with it. So I did not go into it, and I'm sure the unions will have copies of it. So public servants, ask your managers, your team leaders, your whoever they are, supervisors, to show you the copy of that circular. It just came out, I think, a few hours ago, and it deals with how we manage the public service, because regardless to what we do, there's some essential services that must be carried out. We cannot, even though we close down to ordinary people, services must be delivered because we are alive. The only time, and I use my colleague for here, the only time that no service will be offered is when we're dead, and we're all alive at this moment. So some services will have to be. However, let me recap the contents of those orders, just to make sure that the public understand exactly what we are talking about. We have 2 orders. The order number 18 falls under the Immigration Prohibition Act, and it prohibits the entry to Montserrat. 19. SR number 19 of 2020, Immigration Prohibition Entry Act. It prohibits anybody into Montserrat except there are monstrations. Persons who hold a permit or permanent resident issued under Section 23 of the Immigration Act, member of crews or aircrafts, vessels, including freight, cargo, and carrier, and husband and wives and children of dependent of persons who falls under this section. And lastly, any other person as may be determined by the minister for the purpose of the suppression of COVID. For instance, whatever a health team in, specialists in, those persons will be exempted through the minister's request. So that's that order number 19. The more extensive order is order number 18. And number 18 speaks to, it provides for the total shutdown of Montserrat from tomorrow evening at 6 p.m., with the exception of essential services. It provides for no larger gathering than 4 persons at any given time. 4, except for essential service workers and funerals. For funerals, the order makes provision for no more than 15 persons to attend funerals. And of course, we provide for our social distancing, which is critical, the health people tell you, to avoid close contact of persons. There is enforced tomorrow evening at 6 o'clock a curfew, beginning at 7 p.m. and goes until 5 a.m. in the morning. All businesses will be closed. Nobody should be on the street. The police will be on the road. You are to be at home. And the sole purpose of this curfew is to ensure to prevent the spread of COVID-19. Your health is critical. Your health is important to us. During the day, from 5 to 6 p.m., 5 a.m. to 6 p.m., essential businesses will be opened. And persons are allowed on the street to go to the pharmacy, to go to the doctor, to go to the hospital, to visit, to do shopping. These are basic essential services. And these essential services will be opened from 8, I think, well, we say 5, but normally open 8, but 5 in the morning until 6 o'clock in the evening, giving the people, the workers, time to get home by 7 o'clock. Nobody should be on the street, on the road by that time. As I said earlier on, all emergency services are exempted from the order because they must provide the services for us. And the previous order measures that were in place have not been brought forward. So schools are closed. If you come into Montserrat, whether you're Montserratian, you are automatically isolated, mandatory isolation for 14 days, without 14 days. And these are the provisions, and I believe that in the days to come, they'll be meted out to you by the press in little more details. So I want to close by reassuring the Montserrat public that you, as your Premier and your Minister of Health and the authorities, public service, and other key stakeholders, we are actively monitoring the situation, actively. And we will continue to make decisions on future adjustments if the circumstance demands it. Thank you, and God bless.
Thank you very much to our officials, and thank you to our listeners and viewers. Let me also say thank you to members of the press for participating and for continuing to disseminate information on the COVID-19 situation. In terms of the press, I know that you would want a longer question and answer period. However, just be reminded that that may not be possible given the fluid nature of COVID-19 and the commitments of the officials who are managing this situation. The public and the press, updating the public and the press is a key priority. And just to remind listeners as well that the official government channels for information on Montserrat COVID-19 response are Radio Montserrat, GIU Montserrat on Facebook and YouTube, www.gov.ms, that's gov.ms, and Montserrat Ministry of Health and Social Services. Thanks again.
ZJB Radio, Montserrat. Listen to us live on www.zjb.gov.ms.